Spinal is a big chunk of what we see. We'll see a lot of patients with neck pain. We'll see a lot of patients with lower back pain. We'll see a lot of patients with sort of mid-thorax, like ribby type pain. That can be quite acute. We'll see a really good chunk of sport, and I'm trying to think of some good examples. A lot of pain points that we see consistently from our caseload would be having some experiences with various practitioners along the way, and getting to the end of the road and becoming frustrated, not getting the solutions that they're looking for. So we'll often, and it's actually a really nice position to come in because it can be quite a difficult position to guide someone from, but it's a really nice position to come in at and be given the opportunity to give someone a solution and give them some clarity when they've had some average experiences. So I think a really common one, a more specific example without being too specific, would be someone who's had lots of imaging done, and they've had 10 x-rays, and they've had ultrasounds, and there might be a question mark about whether the right structure was actually imaged. I think we see that a bit. Specifically, looking at neck versus shoulder, we'll see a lot of people who present with a history of failed attempts at recovery or finding a solution, and they'll present with a shoulder x-ray and a shoulder ultrasound, and you go through some subjective and objective assessments, and you've actually got more of an impression that it's a neck injury. So that's a really good example of the patient that's had a good chunk of radiation thrown at them, a good chunk of medical expenses down the drain, and the wrong structure's been analysed. So that we see that a fair bit, and it's often neck and shoulder, and often lower back and hip. That's a common one where you'll see someone who maybe hasn't had the right imaging done. So it's a really cool place to be, to have the opportunity to give someone advice and sort of give them clarity and cut through the mixed messaging and the confusion, because it can be super confusing, and then you add to that the fact that they're often in pain. So you've got someone who's had pain, they've got the motivation and the autonomy to go and search for answers, but they don't get the answers they're looking for, not through any fault of their own. They just haven't been guided the right way. So that's a cool opportunity for us.